cancer, that most fearful, dreaded terminal illness. I speak from some experience, having battled the disease myself. And there was a time when it was quite rare, and we now seem to have journeyed to a time when almost every family that one speaks to has somebody or the other suffering some form of cancer. While there have been huge advancements in medical sciences that have alleviated uh, impact of the disease, and people are getting cured, it's also fair to say that um, its profound impact and effect on body and mind still remains very much present. When it comes to women, there is a particular set of cancers that they seem to confront, and a particular set of impact that it tends to have. And to delve into this, we are very privileged that we're being joined by Dr. Kanika Modi Batra. I will leave it to Doctor to talk a little bit more about her practice and the fact that her very sought after expertise has helped numerous women. But very quickly, we are calling this particular session of talk therapy, brought to you by Driveway Devi, Minding Cancer. And I am Karthik on behalf of Driveway Devi. I would like to deeply express my thanks to Doctor for joining us and making the time. Welcome.
Thank you so much, Karthik, and the great initiative that you've taken to talk about, women's health and cancer in particular. Thank you.
Please tell us briefly a little bit about your practice first.
So I'm a gynae surgeon. So basically, I deal with women who have cancers of the gynecological organs, which primarily include ovarian cancer, uterine cancer, cervical cancer, vulva, and vaginal cancer. So typically, this is what constitutes the spectrum of gynecological cancers. And that's the women I deal with. And I am a surgeon. I'm a gynae surgeon. I primarily do surgeries for them.
This set of cancers, Doc, I want to ask you is, are they usually detected by the individuals and patients who come to you, or are they usually discovered by default when there are other routine checkups going on?
So, the kind of setup I work at Max Hospital, Saket in New Delhi. At a tertiary care center, I sit in the oncology unit. So most of the cases that I get, they have already been diagnosed.
Mm-hmm.
So, but in general, women can have some symptoms and they can go to gynecologists near them and they get tested at, a basic local level that I would say, and they're mostly referred to me.
Got it. Understood. So now, of course, you know that ours is primarily focused as a platform and organization on mental health. And therefore, I must ask you that, of course, the physical impact of any cancer is there and obvious and present. But along with that, there is also a very real aspect of how the disease affects one's psychological state and makeup. What are your broad thoughts on this?
So the emotional and psychological aspects of gynecological cancers are immense. There is a deep identity shock that women go through. It because these are the cancers that strike at a woman's core. The uterus, ovaries, cervix, vulva, they are a lot more than just anatomical organs. You know, they're interwoven with notions of femininity, sexuality, fertility, and to a large extent, self-worth of a woman. So the diagnosis over here is not just physical per se. It's also how a woman sees herself after she's been affected with this cancer. A lot of questions they go through. Will I still be a woman if my gynecological organs are taken out? Will I have children? Will my partners still desire me? Is my body going to feel the same? So there's a lot more to the grief that comes with the shock of having cancer, and also specifically of gynecological cancers.
That is such a critical point you've brought up, and that is the precise reason for this conversation because it's so different and so much more nuanced, and in a lot of ways, so much deeper and bigger than. And I'm not trying to obviously belittle anything, but any sort of gender having any regular or other cancer. And if I'm hearing you correctly, one can really sort of start to question if one will be able to fulfill one's purpose even in life.
Absolutely. It's like you become a stranger in your own skin. Firstly, the medical diagnosis of cancer as such, and then, you have a lot of body image and sexuality changes that you undergo. A, from the cancer itself, B, from the treatment and the nuances that the treatment brings with it. So it's layered with a lot of anxiety, avoidance, shame, guilt. Specifically, your most intimate relationships, they suffer and they go for a toss. And it's something that we, practically see also. There's a lot of relationship abandonment that happens while a woman is going through her treatment. And this is the reason why we're talking about it, that while somebody is undergoing all those therapies and changes, there are ways we know how to deal with to get them back to track, to lead a normal life, not just normal in the sense of being cancer free,
Mhm.
but in a more holistic sort of a way.
You know, a lot of dialogues and interactions that we have with mental health professionals, and even for that matter, with just individuals who are society watchers, observers of people, human behavior, gender identity, in the Indian context especially,
Mhm.
uh, are fairly united in their perception that many layers and facets of this guilt that women experience is in fact a an unwanted and needless inheritance of generations of conditioning. And I can't help wonder if some, if not all, of this questioning of identity and will I even remain a woman is a result of that same conditioning rather than a confident self-formed image of oneself of that particular woman.
So that's a very important aspect you've raised, Karthik. Whether it is a problem of the society and patriarchy, and also how women have been sexualized over the years, or is it just cancer of the sexual organs? You know, if one is to really, think about it in a broader perspective, if say a man sort of has some, prostate cancer or testicular cancer, whether they also have those kind of problems versus a woman who's had gynecological or breast cancer for that matter. It's difficult for me to compare like that, but I'm sure it's there in both genders. But if we are to vis-a-vis compare, I think how women's emotions are, how their mental circuits are, how they think and overthink about things, and which leads to a lot of manifestation and psychosomatization, it tends to worsen situations. And that is the reason why we need to be a lot more pragmatic in our approach when we are dealing with women, specifically with gynecological and breast malignancies. And yes, it is deeply rooted, but then whatever the cause may be, whether it is this or that, it's difficult to pinpoint, but it is there for real.
Of course, I completely appreciate that. It was more sort of out of academic curiosity. I do feel that even in terms of men, I suspect quite strongly that if it is indeed a an organ or a part that has any role to play in terms of reproduction or intercourse, etc., there is this definite feeling of, oh my God, I'm not a man any longer. And that has its own sort of neurosis and history and background and conditioning. Um, is there in your case and others such as yourself, although I'm not aware, but I see you as if a highly specialized sort of medical resource, and I don't know if there are too many others like yourself in India, but in your practice or others such as yourself, do you actively therefore advise counseling for your patients and their immediate partners, caregivers, families?
Oh, yes, absolutely. Yes. Right from the beginning, when we are meeting up with our patients, we let them know that we have, in fact, you'd be interested in knowing this. We have a psycho-oncologist in our oncology unit, somebody who specifically takes care of the psychological aspects of all our cancer patients. And
Mhm.
so we introduce this to them that if ever you need it during the course of your treatment, while we are there, while your family is there, it would be nice to layer it up with an additional, professional who can help you specifically in tiding over the mental crisis. And you don't really have to be mentally sick
Of
or in
course.
that situation to be demanding for one. We leave the door open for them.
Hmm.
So there are specialized people who deal specifically with that, and they also, like the psycho-oncologist, very well, they deal with the psychosexual impacts of gynecological malignancies as well.
Have you observed in your practice instances where marriages, etc., have broken up after this kind of illness?
So many times. There is a lot of abandonment that occurs, and a woman is at the receiving end. That, we have a lot of young patients who come with malignancy, and once their reproductive organs are out, they're seen as somebody who's not going to be fertile or of any use for the next generation. So it's primarily not so much from their partner as such, because a partner is still deeply invested in you, but a lot of side things in the family that happen which kind of pressurize uh, your partner into just abandoning you. It happens. And sometimes it's a phase, sometimes it's permanence. So it does happen. So apart from all the things that you're undergoing yourself, there is somebody who's so close to you who leaves you right at that moment. So it just completely shatters you.
Absolutely, but in my limited understanding and exposure, I would agree with you because many times it's not the immediate partner, but because in any case, the way our society is constructed for right or wrong reasons, there are so many. Everybody and his uncle has an opinion, and they tend to get involved. I was very, very privileged. I was having a chat with a similar dialogue with very iconic author Jerry Pinto, and Jerry's a lot of his books delve into mental health very deeply because his characters tend to be afflicted with one or the other condition. And he was telling me about a friend of his whose wife had cancer, and that he consciously didn't reveal this to anybody because he had seen in that family the older people, etc., saying and immediately labeling that lady as being a bad omen and this and that and the other. So it's very sad that these prejudices are so deep rooted and they exist. Um, what are some things? See, because the not everybody has either the wisdom or the opportunity to even, for example, access somebody such as yourself, and that level and degree of medical care, etc. And even lesser when it comes to mental health, to go and seek counseling, therapy. Uh, I know this is a very generic sort of question, but what are some suggestions you can share with an individual, with a lady who has a particular cancer, and what she and people immediately around her could potentially do to at least little bit, to some degree, lessen the psychological impact?
Okay. So, first and foremost, to all the women who come to my clinic, I tell them to shift their focus from everything else to themselves, because a woman is a caregiver in almost all situations. I tell them to just forget about everybody, what's happening to your kids right now, whether they're going to school or no, what's happening to your husband, is he getting his lunch for the office or no, what's happening to the house. Just forget everything. You need to focus on yourself. Only when you are full will you be able to give anything to anyone. You're already fractured because of a disease that has affected you. It's time to concentrate all your energy around yourself so that soon you're going to be in a nurturing position as you want to be. But until then, just primarily focus on yourself. Then I tell them to kind of, apart from all the investigations we are building on and the rest of the things, whatever therapy, whether a surgery, a chemo or radiation, whatever we are trying to build up for her case, we tell them to every day actively involve yourself in a meditation where you just try to calm yourself down. Whatever gives you peace. Meditation doesn't necessarily have to be a form where you have to be sitting quiet, but if just watering the plants is meditative for you, please do that. But take out that amount of time for that purpose to just heal yourself by yourself. Then, while the mental aspects are being taken care of, we tell them to not to indulge into taking too many opinions from their relatives here, there, everywhere, and just keep the toxic energies away, because people are going to give them and they emanate that in a very subtle way. We tell them to just kind of focus on your treatment right now and keep all the toxic energies and just be uh, with the right kind of people who give you the positive energy while you're undergoing this treatment. You can ignore everybody else and deal with them later in life when you're back on track. Then, apart from this, while they come with their own, attendants, family, or close friends, whomsoever they come with, we tell them to just be supportive of their extra medical and psychological needs that are going to occur. If they undergo mood swings, it's absolutely fine. If they break down, it's absolutely okay. Just let them grieve for whatsoever reason they want to grieve. Just it's important to hear them out rather than actively provide any kind of solution or sympathy for that matter.
Hmm. That's all absolutely excellent advice. Final question. I know you're doing this in the midst of lots of personal and professional commitments. Um, and this question itself may sound extremely ignorant and naive, because I confess that I know little to nothing on the subject itself. But is there anything medically, and I'm not talking psychologically now, any two, three, four really telltale signs or red flags that women ought to and can watch out for as they progress in life, as they hit certain age milestones or other milestones that could, facilitate as early detection as possible?
So, screening is the most important step towards it. For women, we have breast cancer screening that a woman needs to undergo mammogram after the age of 40 every once in 2 years.
Mhm.
Apart from this, cervical cancer is an absolutely preventable cancer. There is a very good vaccine
Hmm.
younger women can take, and for women older than that, we recommend a pap smear and HPV testing which are excellent modalities to detect pre-invasive lesions. Apart from this, just regularly getting your ultrasounds done, blood workup done once in a year is important as a part of screening. And listening to your body if you have any abnormal signs or symptoms like any abnormal bleeding, discharge, or a bloating sensation which is not going away, digestive issues which are not going away, or you're feeling unusual in any way, just go get yourself checked by any doctor, get the investigations done. It's important to just be aware when your body is trying to say something to you.
I
Don't ignore.
completely take that point. I'm going to take the liberty of interrupting you because when you say go to a doctor and get investigations done, whom should that doctor ideally be? Should it be that person's gynac? Should it be a gastro, since you talked about bloating, etc.? Who should it be?
So depends again on the kind of problem. If you're having abnormal bleeding or discharge, a gynec is the right person. And if it's just bloating and gastric issues that you're facing, a gastro or a
Right. So
physician.
your symptoms will dictate who you go to.
Exactly.
Okay. And, I think you might agree that there's a lot of these days, at least to a lay person, there's a lot of confusion because there are so many contradictory opinions out there, each one sounding more convincing than the other, specifically in terms of diet and nutrition. एग्स अच्छे होते हैं नहीं होते हैं मिल्क अच्छा होता है नहीं होता है and I also suspect, and forgive my cynicism, but there's a lot of lobbying also that goes on, and so industries and sectors and food types have their people all over the place promoting certain things. Any things to avoid from a nutritional point of view, generally speaking, for women?
Yeah, for women and for men in general, although I'm not a nutritionist per se, but just safeguarding yourself from certain harmful chemicals is what I would say. Some recommendations would be to avoid red meat in too much amounts, avoid processed meat, and try to avoid anything that comes out of a packet like that, that's pre-packaged, additives, colors, and all that, and
Correct.
try to have as much of freshly cooked food items as possible, and avoid those Teflon coated utensils. We know that Teflon kind of reacts once it's heated, and microwaving is good for regular use when you're just trying to reheat stuff, but avoid it when you want to
Cooking, baking.
meals. Yeah. So these are some simple steps. Just, consuming the right amounts of fibers and adequate amount of proteins in the form of lean meat, eggs are good, and the vegetarian sources of proteins, they're all great. And just having a high fiber diet is very important.
Wonderful. Would it be fair for me to sum up by saying, and not that I'm dispensing anything that's rocket science, it's absolute common sense and, in fact, common knowledge. But um, if, God forbid, there is a situation where an individual, a lady, is detected with any of these kinds of gynec cancers, that not only does she, but immediate people around her also need to all rally together to try and make this entire process as sort of less painful and unsavory as possible. Particularly, I would imagine the partner, the in laws in the Indian construct, these people, certain very, very close key friends, would all have to ideally be on the same page, be extremely positive, find it from wherever to have that optimistic, positive attitude and rally around that person.
Oh, yes, absolutely. I think it's the responsibility of not just an individual who's undergoing treatment, but it takes a village to get a person back. So all the things that you mentioned are of immense importance.
Wonderful. It's been so great. It's been really eye opening to me personally, and I'm sure it will be for many, many listeners as well. The insights that you've shared, the advice that you've shared. We really appreciate once again you making the time in such busy circumstances. Thank you very much, and thank you for the wonderful work that you do.
Thank you so much, Karthik, and my best wishes for your channel, and you're doing a great work yourself. Please, more power to you.
Thank you. Really appreciate it.